fill a critical information gap that's been exposed by COVID-19. This will help the world move faster to prevent future pandemics. This hub is emblematic of the leadership that Chancellor Merkel has brought to Germany and the world. The Chancellor has always understood that public health is a global concern. It affects everyone, no matter where you live. And by putting Germany at the forefront of global health efforts, including being an early contributor to COVAX and to CEPI, she has laid a powerful marker for other world leaders to follow. Thank you, Chancellor Merkel, for your work, your wisdom, and your inspiring leadership. And congratulations to everyone on the hub.
This has been a very historic meeting because we address a contemporary issue of great importance that touches on the lives and economies of many African countries. And this has been made possible by the platform that Chancellor Merkel set up. And we would like, as the African continent, to thank her for the initiative that she took in 2017 when Germany was president of the G20, coming up with this great initiative to focus on Africa. She's been a champion of the African continent. She supported the many initiatives that we are engaged in Africa, and Africa is going to miss her greatly. What she has contributed in just boosting Africa is great. There are many initiatives across a number of countries that have been supported as a result of this G20 compact with Africa. So we thank her and we honor Chancellor Merkel, and we bid a wonderful farewell as a continent. All of us express our great thanks to her.
Das bringt uns zum letzten Teil.
And this leads us to the last part of our event today. Many of you, the people who went a part of the way together with you over the last years, wanted to thank you for this time, and others were not able to send a video, but will send you a letter instead, so you can expect a lot more good wishes for your future to come.
As my boss, my leader, mentor, colleague, to come up to stage to give your thoughts. Thank you.
Thank you. Thank you. Your Excellency, Dr. Angela Merkel, Chancellor of the Federal Republic of Germany, Your Excellency and my friend Jens Spahn, Federal Minister of Health, Your Excellency Michael Müller, Governing Mayor of Berlin, distinguished guests, dear colleagues and friends. Ich freue mich, heute in Berlin.
I am happy to be here in Berlin today, and I thank the Federal Chancellor Merkel. I thank the Governing Mayor Müller and Federal Minister Spahn, and I also thank all Berliners for so warmly welcoming me and for the wonderful reception.
I think Chancellor is also teaching the Secretary General, so he's teaching us all some words. I picked a lot from Bernard and Spahn and Katharina. So thank you so much. This is an honor and a privilege to be here today for the opening of the WHO Hub for Pandemic and Epidemic Intelligence. I want to start by taking you back to 2015, when the terrible West African Ebola outbreak was just beginning to be brought under control. At the world gathered in Geneva for the World Health Assembly, questions were being asked about how this could have happened. There was a speaker at the assembly that year. It was, of course, Chancellor Merkel. This is what she said, I will quote, "The war will only have been won when there are no new infections. In fact, it will only really be won when we are properly equipped to face the next crisis. In other words, when we have learned from this crisis. One lesson that we all need to learn is that we should have reacted sooner. We thus have to ask how we can do that." That's end of quote from Chancellor. Lessons were learned from our experience in West Africa that have helped the response to subsequent outbreaks of Ebola in the Democratic Republic of the Congo. Those outbreaks were brought under control without spreading across borders as they did in West Africa. Even though the North Kivu outbreak occurred in a highly unstable and insecure environment and very close to the border with Uganda. But the lessons from West Africa were not sufficient to prepare the world for a global pandemic, for a respiratory pathogen. So the advice from the Chancellor still stays and is very relevant. The COVID-19 pandemic is the defining crisis of our time. It has taught the world many painful lessons. One of the most clear is the need for new, powerful systems and tools for global surveillance to collect, analyze, and disseminate data on outbreaks with the potential to become epidemics and pandemics. Viruses move fast, but data can move even faster. With the right information, countries and communities can stay ahead of emerging risks and save lives. Urbanization, deforestation, climate change, and intensified agricultural practices are all increasing the risks of zoonosis, spilling over into human populations. At the same time, new technologies are giving us the ability to predict, prevent, detect, and respond to outbreaks faster than ever before. Harnessing the power of these new technologies to save lives is not just an opportunity, it is an obligation. As the German saying goes, "Wer rastet, der rostet." Who rests, rusts. That's what the WHO Hub for Pandemic and Epidemic Intelligence is all about. Leveraging innovations in data science, harnessing the power of artificial intelligence, quantum computing, and other cutting-edge technologies, and fostering greater sharing of data and information between communities and countries. No single institution or nation can do this alone. That's why we have coined the term collaborative intelligence to sum up our collective mission. This hub will bring together scientists, innovators, policymakers, and civil society representatives from around the world to work across borders, disciplines, making collaborative intelligence a reality. Of course, the ultimate goal is not just to develop new toys, it is to save lives. Our aim is to put the knowledge and insights that are developed here in Berlin to practical use on the ground all over the world. As you know, there have been several reviews of the global response to the pandemic, with recommendations for countries and for WHO about what we can do to keep the world safer in the future. This hub is one response to those recommendations, filling a gap in the world's defenses and answering the question that Chancellor Merkel asked in 2015. How can we react faster to avoid the needless suffering and death of the COVID-19 pandemic in future? Maybe she didn't connect what she asked then and what it is. So there is already behind the decision to have the hub here what she was advocating for. For WHO, this is part of our commitment to keeping the world safer, to being the organization the world needs, and to giving countries the information and tools they need to protect their people. My brother Chikwe is the perfect person to lead the WHO hub. He brings vision and experience and will be an excellent addition to our WHO leadership team. So thank you so much for accepting the challenge. And Berlin is the perfect place to host it. As a vibrant, dynamic, creative, and modern city, that's the ideal incubator for what we want to achieve, as my friend Minister Spahan said. My thanks once again to Governing Mayor Muller and the people of Berlin for hosting the WHO Hub, and to the federal government for its generous financial support. So many people have come together and worked so hard, so quickly to make this happen. I would especially like to offer my profound thanks and appreciation to my friend and brother, Dr. Bernhard Schwattlander, who has devoted himself to bringing us all to this moment. As some of you know, Bernhard is leaving WHO to take up a new role with the German government. And as you all know, Bernhard is a WHO institution with decades of experience in HIV as a WHO representative and as my chief de cabinet for 3.5 years, steering the WHO ship through some difficult waters. His last assignment was to build this new ship here in Berlin. So he knows how to steer a ship and also how to build a ship. We are reluctantly saying goodbye to Bernhard. WHO's loss is Germany's gain. So he's not going anywhere still. My brother, we will miss you. I will personally miss you. Thank you from the bottom of my heart, and we wish you every success for the next chapter of your life and career. As always, I'm proud of you and continue to be proud of you. Excellencies, colleagues and friends, no one has done more to make the vision of the WHO Hub a reality than Chancellor Merkel. Under her leadership, Germany has become a leading advocate for global health. This is not a recent development or a sudden realization that health matters in the wake of a pandemic. Health has been a central theme of Chancellor Merkel's leadership throughout her tenure. This began with 2007 G8 summit in Dam, which mobilized $60 billion for global health. In 2015, she addressed the World Health Assembly at a critical moment in global health. In 2017, in my first week as Director General, I had the honor of attending the G20 summit in Hamburg, where under Chancellor Merkel's leadership, Germany put a very strong emphasis on health and emergency preparedness. And as part of Germany's G20 presidency, Chancellor Merkel also initiated the first ever meeting of G20 health ministers, which included a health emergency simulation exercise. But you know what happened in Hamburg, which I will always remember and cherish. But that was an incredible opportunity for WHO. And you were a pathfinder, and I think other leaders followed your lead. And WHO is now a very active participant in all G20 meetings after Hamburg. In 2019, together with the Prime Minister of Norway, Erna Solberg, and the President of Ghana, Nana Akufo-Addo, she also initiated the Global Action Plan for Healthy Lives and Well-being for All, bringing together 13 multilateral health partners to develop a coherent approach for achieving the health-related targets in the Sustainable Development Goals. When the COVID-19 pandemic struck, the German government moved quickly to expand its financial support for WHO, becoming our biggest donor and was one of the first supporters of the Access to COVID-19 Tools Accelerator. And my good friend and brother Jens Spahn coming to Geneva to help, not only the financial, but also the political support. Thank you so much, Jens. In October last year, I was honored to speak to Chancellor Merkel, which is when we first discussed the idea of a new center that would serve as a global platform to enhance global capacity for pandemic and epidemic intelligence, which brings us today. We have arrived at this moment in no small part because of one woman who says what she means and means what she says. The first time I spoke to her about the center, she just understood it because she has been already advocating for the same. And we didn't have another cycle of discussion to explain or clarify. I began by reminding you of Chancellor Merkel's speech to the World Health Assembly in 2015. She concluded that speech with an appeal that, I quote, "Every single person is vitally needed to fight for the human right to health," end of quote. As usual, she was right. The right to health is not a job for one organization or one leader. It's a job for every single one of us, every single day. Your Excellency, I dare to call you my friend. You have more than played your part. Your leadership, integrity, humility, above all, humility and dedication are an example to us all. I'm not saying this as just DG only. I had the privilege also of meeting you when I was Foreign Minister of Ethiopia. And I saw consistency in your behavior. Just the things I said, your leadership, integrity, humility, and dedication are an example to us all. You have served your country with great distinction, but you have also served the people of the world with the same distinction. And I know that whatever life brings you in the months and years ahead, you will continue to serve others and you will continue to work for the right to health. Your legacy for global health will be so much more than your name on a plaque on a wall in Berlin. It will be etched in the lives of people all over the world for years to come, who will enjoy healthier and safer lives because of you. You have my deep admiration, my deep respect, and my deep gratitude. It's therefore with both pride and humility that I have the honor to present you with the WHO Global Leadership Award in recognition of your outstanding contribution to the health of the world's people. My friends, please join me in showing our appreciation and respect for Her Excellency, Dr. Angela Merkel. Thank you.
Lassen. Das war nicht geplant.
Ja, sehr geehrter
Secretary General, dear Tedros, dear Mr. Ryan, Herr Schwartländer, Minister, dear Jens Spahn, Governing Mayor, dear Michael Müller, Excellencies, ladies and gentlemen. When listening to your words of praise, I thought to myself that there's still so much left that I haven't managed to do, to give the right perspective on these matters. But I would like to thank you for presenting me with this award. And I would like to thank you for your very warm words. But I'm equally grateful to you and the staff of WHO for the efforts that WHO has undertaken and is undertaking on a daily basis. Indeed, the work of WHO have always been a matter truly dear to my heart. And thus, I am especially pleased about the fact that we're here together on the occasion of opening the WHO office in Berlin, the so-called hub. On behalf of many Germans, I would like to extend a very warm welcome to all of you. And I do think it's fair to say, and I take some pride in making those comments, as I think does the governing mayor, that Berlin is a good location for this center. With the Charité, the Robert Koch Institute and the Hasso-Plattner Institute in Potsdam and the Potsdam Institute for Climate Impact Research, we already have a high level of expertise and networking at the international level represented here. So in a way, Berlin has become a startup city. So ideas will be here aplenty, I trust. And I also believe that this center of the WHO, that this hub, is also an expression of the high regard Germany has for the work of the WHO. But this is, as I said, not exclusive to Germany and the WHO. Rather, having listened to this impressive discussion earlier, it is about gathering and collecting data globally, analyzing them globally, and the insights that this center is to gain are to be shared with all the other governments and states. And I think it is very symbolic that in Fabiola Gianotti, the head of CERN, an organization that really focusing on connecting the world and has acquired a global reputation here, it gives us an example of what structures are about. Of course, it's a bit more difficult when you wander from CERN in the direction of the WHO, because you have to somehow depart from the research area into the sector of application. But the fundamental structure that CERN lives on a daily basis is, multilateralism lived on a daily basis. As I said, we want to prepare ourselves for future epidemics and pandemics. Tedros quoted from our efforts in fighting or trying to fight Ebola when we called the first ministers' conference of the ministers of health. But at the time, I wasn't aware or I didn't really know that we too in Europe could be hard hit by a pandemic. I always made the point that we have to be careful to avoid something like that coming to Europe. But I think times have changed and we have to learn our new lessons. I'm delighted that Chikwe, and I take the liberty to call you Chikwe because I find it so difficult to pronounce your surname. I apologize for that. He has given us an identity. I think he is the ideal bridge between Europe and Africa. Probably Nigeria, the Nigerians aren't all that happy to see you wander off in the direction of Germany. But I, for one, am very convinced, very confident that you will point us to us time and again that we need to maintain contacts to other continents and in particular the African continent. The COVID pandemic has illustrated how much we can actually achieve if we combine our strengths. Experts from all over the world at enormous speed have been able to enhance and share their expertise and their knowledge in order to decode the coronavirus. We Germans take some pride in the fact that the first PCR test was developed here in the Charité with the help of Mr. Drosten as early as in January 2020. We also helped in the development of vaccines, and the fact that Catalina was here on the rostrum today is more than symbolic. I listened with a great degree, read with a great degree of enthusiasm the story of her life. We finished our studies at the same time, she in Hungary, I in the GDR. And then you spent the whole your life, all of your life on studying something where there was nobody assisting you. You kept going. You didn't tire in your efforts, taking difficult paths, intricate paths, and now you present us with something on which we can base our work, and it helped us tackle the challenge of developing a vaccine queen. That is an impressive biography indeed. It was in April 2020 that we founded the ACT Accelerator, the ACTA, coordinated by the World Health Organization. The only difficult thing about it is that I think with the exception of us insiders, nobody knows what it is really about. So in order to make sure that it continues to be complicated, we established this vaccine pillar and called it COVAX. Not that easy to make understandable to others, but COVAX is very committed to making available vaccines to everyone, to distribute them globally. So I hosted a few African presidents last week. We know that vaccination levels on the African continent reach only 2%, and we know that we have to increase our offer to them. We have to make sure that this difference is being bridged quickly. We also talked about the production of vaccines in developing countries. As I said to the African countries, this is not the moment for a TRIPS waiver. It's important, and it's the moment for sharing our knowledge and expertise, allowing participation, granting licenses speedily, and above all, establishing the substance of well-educated and trained and skilled staff for the overall pharmaceutical area. We might not have to immediately begin with mRNA. Vaccines can do that too, of course, but there are other areas that need to be covered and where production ought to be established there. We all have realized how vulnerable supply chains can be and that they don't always work as a consequence. We need to take action together, and above all, we need to understand that it is not enough to vaccinate 1 or 2 people, but everyone has to be vaccinated in order to avoid further mutations that will make it difficult for us to get out of the pandemic. For me, the pandemic is also proof of the fact how urgently needed WHO is. It is the authority for global health. And that is why we have to make sure that its funding is placed on a sound and reliable foundation. With the help of the WHO, we can detect threats and dangers for public health at an early stage. However, we also have to realize that the World Health Organization can only be as good as the member states allow it to be by handing or transferring responsibility and remit. That is, of course, nothing that the Director General can heal or change. But we need WHO. We need the WHO and its global structures, not only when it comes to fighting pandemics. Mr. Tedros pointed to the Global Action Plan for Healthy Lives and Well-being for All. You know, there are so many organizations in the United Nations that tend to closely related subject matters, and it was thus good to see that there are 13 international organizations that are ready to cooperate. Whether we will succeed in doing that, we'll have to wait and see, to exchange data and so on and so forth, apply the same standards without having any double effort. It's going to be complicated, but I think we need that kind of cooperation. And as I said to the Secretary General of the United Nations, Secretary General Guterres, that is, who spoke to us earlier here via video link, I said to him that we need to enhance and we have to work to expand the Global Action Plan. The pandemic has made it more difficult, even more difficult to achieve the sustainability goals. It was already difficult before the pandemic. Health for everyone is one of the core goals enshrined in the Sustainable Development Goals, and that is why we have to gather speed in the coming years. The Ebola crisis served as a wake-up call. It brought home to us at the time that it has to be put on the international agenda. We have reacted more speedily, and we have to make sure that we become even faster and quicker in our response in the future. We also have to make sure that we link up or network our researchers. Networking is a very important term here. We have to gather and collect and analyze and put into an order the data that are there. Germany is not always the easiest partner as far as that is concerned. Please turn to me. Don't hesitate to let me know if you have difficulties in that regard. I'm responsible for the federal bodies, and we hope that we can set a good example here. And of course, what the hub can also do is provide advice to many countries and governments, and that is the idea behind the hub. What is important to do, and that became visible in the podium discussion we had earlier today, that we need to have one approach, one health approach, that we pursue that approach. And I think that Sabine and Ilona have made that very clear in describing the social component. Well, basically what this is about to some extent is that after having seen this high level of specialization in a number of scientific areas, we return to the both Humboldts. And I think that the Charité may be a major independent construct, but it is nevertheless linked up to the university landscape to quite some extent. So it's fair to say that what Alexander and Wilhelm von Humboldt practiced on a daily basis has to come on top of the insights we have gained in specializing in particular different disciplines. And that is what we intend to make a contribution to by setting up this hub. I hope we will be able to gather all the contributions, that it will be able to gain the trust of everyone. You have acquired experience in motivating your people. You described this in wonderful words, that the motivation comes from believing in oneself, having confidence in oneself, confidence in one's ability to achieve, and to link that up. And I think that sounds good. And thus I wish you a very good environment, as we now tend to say, so that you can work full steam for a better health, better global health, and a better preparation and preparedness for future crises, which will probably unfortunately come. Thank you very much for coming here and joining us in sending out a signal of hope in that regard from this event today. Thank you very much indeed.
Dr. Angela Merkel, German Chancellor, there, just wrapping up her address at the inauguration of the new Global World Health Organization Hub for Pandemic and Epidemic Intelligence in Berlin. Now, this hub will be a global platform for pandemic and epidemic intelligence, creating shared and networked access to vital multi-sectoral data, driving innovations in data analytics and building the communities of practice needed to predict, prevent, detect, prepare for and respond to worldwide health threats. Well, Angela Merkel saying there that it's very important for everybody to vaccinate, to prevent, all the various strains that we are now getting, and also for the virus to mutate. Well, we'll bring you more of our